Patient is at the core of the healthcare system. That's very important. Here the health services are tailored to meet the individual needs, values, socio-economic status of patients and circumstances of patients. The goal of the patient-centric healthcare is to ensure patients are actively involved in the healthcare treatment, decisions leading to better outcomes. Very important. This would be the most efficient healthcare system, I would have thought. How do we do this? Why patient-centric? Improve the patient satisfaction and experience. That's a different experience. Better healthcare outcomes. Reduced medical errors. Very important. Enhanced adherence to treatment plans. Once you have taken a decision for a particular treatment, then you cannot change. If you have to change, you go back to the patient and the kith and kins and other doctors, then only change your treatment plan. You have a medical board, obviously, in some hospitals per se, but that should be included. The patient and their relations and close friends also must be included. Increased patient engagement and empowerment, very important. This will strengthen the patient-doctor relationship. And you can see here, the patient is in the center of the healthcare system, center of the circle, center of the arena, most important person. The doctor, nurse, kith and kins, and paramedical staff, all others revolve around them. If all of us can think in that direction, the goal is achieved. Doctor comes first. His role is that of a role model. He must present himself. He must communicate very well to the patient. So also every member of the core team, care team, we all have to play an equal role, an important role. The key principles of patient-centered care. Empathy. Empathy, it means simply just a word. Extreme compassion to the patient. They come with pain, agony, and other problems. Shared decision-taking makes life easier. And culturally competent. We live in a diverse cultural society, whether it is in Kerala, any part of India. Personalized treatment plans, very important. What is empathy? Yeah, as I said, extreme compassion to the patient. Encourage health care professionals, mostly the clinicians. Listen to them attentively, looking at their eyes. Understand the patient concerns and needs. Empathy fosters a strong patient-provider relationship. Shared decision-making. Explain the importance. Once you have taken a decision, sir, I didn't know this earlier. I wouldn't have agreed. You are operating for a metabolic surgery in obesity, that is curing diabetes. I know most of you know it actually. Diabetes can be cured by operation in obese patients. 90% of the obese are diabetics, 90% are obese. So if you correct obesity, you can cure diabetes. And from lower BMI, you can do this. Metabolic surgery, you reverse, the stomach is made into a small stomach, then bypass 150 to 200 centimeters of the upper small bowel. This is a medical information for you. That will cure diabetes, provided the C-peptide stays above 2.5 units. And 100% you can achieve cure. So you must explain to them, suppose it doesn't cure, it is not cured or immediately, then you must be able to explain to him the reasons. So he'll ask you the question at the end. So you said, my diabetes will go. You just wait for 3 months, it will go. So you have to see what sort of diet he's taking. This is very important. Explain the importance of involving patients. This is very important today with advancing technology. And laparoscopic surgery is now included in the RAC. This is risk analysis area. RCA, risk analysis. Anyway, like you practice in the radiation department, etc. What is it called? Ethical RAC? Something like that, actually. I just don't get the word. Anyway, even laparoscopic surgery is considered. Patient risk is involved when you operate the patient remotely looking at the monitor. This is very important. This is the operation you are going to have. You have to explain to them very clearly what are the risks involved. The shared decision-making as a collaborative approach. More people involved. It's a collective decision. Emphasize the significance of understanding and respecting the diverse cultural backgrounds of patients in any part of the world. Advocate tailored treatment. Individual patient preferences, values, and circumstances are taken into account. Highlight the role of patient preferences in decision making. I'm reading through it because the time is only 10 minutes. I'll have also some points to mention in general. So in Kerala, the challenges right now, actually, the diabetes is more than 20% of the adult population have diabetes. Diabetes type 2 starts from 15 years of age. I had a boy of 19 with 155 kilos and 19-year-old studying for +2 second year. His name I am not going to, you are not supposed to. Yeah, it doesn't matter. Harikrishnan, many Harikrishans are there anyway. His name is Harikrishnan. I did only a sleeve gastrectomy. He was taking 60 units of insulin. His diabetes is gone. And control of diet. What is the diet? Plenty of rice, plenty of fat, large meals, 5-star hot meals, 3-star, 4-star hotel meals. Heavy meals at night will give you something like 2,000 calories easily. What is your requirement? Maybe 1,500 calories. My requirement, I would think, is 1,200 calories per day. I work for about 10 to 12 hours a day. Still, I would think below 1,500. Your dinner at night will give you something like 2,000 calories. Be careful about fat and sugars. If you can get rid of those things, what's the best diet? Vegetables, fruits, water, protein, and exercise. Plenty of water. 70% of our body is water. Plenty of water. That's the best thing you can do. And advice to your patients. 40% hypertension is so rampant and unrecognized. 30 to 40%. 30% alcoholism in Kerala especially. And 20% obesity, like Europe, 20% or more. And first state in the country to have more obesity is Punjab, 30%, 35%, like in America. We are reaching the stage of Europe, 20 to 23, 24%. every 1 in 5 is obese or overweight. This is very important information. Physical inactivity, 25% of people are physically inactive, sit idle. And 20% have unhealthy alcoholism. That's the cause of cirrhosis and more cancer, liver, is increasing on the increase, plus hepatitis. There is, you don't have to have a second question, where is the cancer from? Alcohol and hepatitis and cirrhosis. Hepatitis C especially. And about the hospitals, there are 3 types of hospitals, small, medium, large. It is not the case for me, actually. It is like corporate hospital where you have all the specialists, all the specialties, and extra facilities, and whatever you want, including spa, is available, whether that is needed. That's another thing. Why the common man is not able to afford the 5-star or corporate hospital facilities? You must think of the common man. They make 80%, and the poor of the population or more. Then you have limited specialty hospitals where you give care for the primary and secondary care hospitals. Also tertiary care. Where you give tertiary, you have some specialties which are your trump card. That is something like laparoscopic surgery, obesity surgery, urology, orthopedics. Like Dr. Ashokan's place was well known for orthopedics, actually. You have a special area where you give tertiary care, the ultimate care. Then single specialty hospital, that come in more numbers in future. Why? Because it's easy to manage, limited space, limited money, limited staff, limited problems, results are very good. Develop single specialty, ultimate centers with lesser income. That is going to be the future, I would have thought. And limited specialty, single specialty, I said, limited specialty hospitals, they have problem because the other specialties do not bring in any income, limited income. Limited specialty means limited income because other specialties are not prospering. You can manage break even, maybe, or less in other specialties. 2-3 specialties manage the whole hospital. So they are always under stress. The SBA man, the manager should have been here to listen to this. You must have disappeared. And that is about the hospitals. I don't have small hospital, bigger hospital. You can rate the surgeon a small, medium, and large. You see, I'll go to the other area, then I'll come to that. Preventive health care is very poor in our country. That is what you have to think about it. That will definitely sell more, I would have thought. With our emerging new diseases, obesity, hypertension, stroke, and other diseases, cancer is obesity is one of the causes of increasing. Dr. Sadila, good evening, good morning. And one of the major causes of cancer, obesity, something like 30%. So beware of obesity. Cut down your fat and sugar. The cancer cells want only sugar and neighboring sugar that will take away, and fat. Be careful. And do we really need luxury hospitals? This is disclaimer, not pointing to anybody, not Kim's or Asta, anybody. Just my thoughts, actually. This is a common man's thought. Do we really need luxury hospitals? Luxury means take that luxury on one side and treatment part on the other side. Treatment must be perfect wherever you do it, whether it is in a small hospital, a medium hospital, a corporate hospital, limited specialty or in a single specialty. Single specialty, definitely you can achieve the best result because they are aiming at only one specialty. And why I asked this question, luxury hospitals? Take away the luxury part. You know what is happening? Luxury facilities, then the treatment and surgery, and treatment part of the surgery or medicine. Once you find that is done in an accredited hospital, it should be the same. The luxury part, take it away. That's the only way common man can afford going to a tertiary care hospital, a corporate hospital. The insurance companies take advantage. They play a double role. They have a two-tier system. It is not the luxury patient needs, minimal luxury when you go for treatment, but not the spa and other luxuries and music. I operate while I have music while operating. People used to ask me, how can you have music while operating? My humble answer was this, that fine-tunes my fingers actually. This is very important. If you have a melodious music, that will fine-tune the surgery. It is not luxury that patient needs, but the right treatment. There must be a system to evaluate the quality and competency of physicians and surgeons, and the treatment bills must be fixed without prejudice. Treatment part. This will help probably people like me, the middle class, or the low middle class, or the poor, to go to a tertiary care center, a corporate hospital. That's my humble feeling. And then apart from this, I have a few other points, if you have time. That is, see, medical service, medical profession, your bounden duty is, one is kriya, the other thing is karma. Kriya is what? You do something for earning your livelihood. Karma is something without any expectation. That is bound, and kriya and karma goes together in medical profession. That's the only profession this is the dictum. And how you make yourself a successful person? Your success depends on two things, long-term success. Embrace medical ethics. Your honesty, hard work will eventually lead you to success, your destiny. Are you in the right path? We have several medical schools without adequate teachers, trained teachers with newer technologies like laparoscopy, robotic, and they don't get to know anything about. One of the problems we are facing today is that in the healthcare sector, an MBBS doctor, junior doctor, after only a house job, is posted to a casualty in a tertiary, a secondary, a primary care center. How will he manage in a developed country? We have to take examples of developed country. In England, for example, if you have to become a general practitioner, he's a general practitioner, you have to pass a qualifying exam. Like you have MRCP in medicine, like you have MRCS in surgery, they have to qualify an exam called MRCGP. That's a postgraduate examination in general practice. This is very important. Even if you have MRCP or MRCS, still you have to do this. That is for 3 years. Then only they must be posted to the emergency services and health services in a primary health center. This is very important to save lives of innocent people.